I'm your host, Jennifer Pulapaka with Podiatry Doc Talk. Regain your health with quick and ingenious tips and chats so you can be stronger and healthier. I'm here, making complex foot and ankle problems sensible and simple. Episode 7. Keeping wounds moist or dry? That's the question. Is it better to keep a wound moist or to let it air out? There's a lot of confusion about this. In fact, the notion is still widespread that air aids in the healing process. So you need to let the wound dry out in air? No, that assumption's incorrect, and various studies have demonstrated this falsity over the past decades. So now you ask, what's the best way to take care of a wound and how do you minimize scarring? What you may not know about scabbing is the fact that scabs slow the wound healing process. When wounds are kept exposed to air, they'll dry out, they'll form a scab. You see, cells are naturally moist. They're not dry. And the purpose of the scab was used to protect the wound from environmental contamination. But at the same time, scabbing has some disadvantages. A scab forms a barrier around new tissue. Studies have shown that under the influence of scabbing, the regenerative portions of the wound healing process, they take more time, and thus increasing your risk of scarring. Moist wounds prevent formation of hard scabs, which acts as a barrier in the development of new tissue. This was noted by Dr. Bruce Katz. He's a clinical professor at Columbia University. Scabs inhibit quick healing, and they're blockades. They block the skin's process for creating new cells and tissue. Think of it this way. Grass doesn't grow well under a rock, and skin cells don't grow well under a scab. So why do you keep a wound moist? That's a good question. The answer is fairly straightforward. Wounds heal faster and better when they're kept moist. The first scientist to discover this was in 1962. It was George Winter. He found out that regrowth of skin would proceed twice as fast in a moist wound environment than under a scab. He demonstrated in a controlled study wounds healed when covered with a thin film in about 12 to 15 days, while similar wounds exposed to air took about 25 to 30 days. You see, our body cells need moisture to survive. Wounds heal 50 times faster in a moist, protected environment where there's less risk of infection. You also have to remember, exposed wounds run the risk of infection, which complicates matters for diabetic and vascular disease patients. Now that we know this, moist wound healing is considered the ideal environment for optimum wound healing. The development of a scab is no longer necessary. And we use advanced wound care dressings that enhance the body's natural defenses, they promote the healing process, and they contribute to the overall comfort of a patient. So the next time you want to air out a wound, remember, it's not a butterfly trapped in a jar. Keep your wound covered and moist, and you'll be on the road to a speedy recovery.